Hi guys, so I was challenged to create a block of 5 progressive sessions for a participant with a method of periodisation of my choice. Before I actually get into what I've done specifically, I'll first just go through some of the client information just so you get an idea of who the client was. My participant used in this progressive 5-week block was 16-year-old Rio Fox. He stands 173 centimetres tall and weighs 73 kilos. Rio's main sport is football, and he plays centre midfield. His main goal when starting the programme was to increase his full body strength. However, he has encountered a serious injury in the past 6 months, that being an avulsion fracture of the hip. This is where a fragment of bone is pulled away from the main bony mass as a result of a sudden tensile force applied for a powerful muscle contraction. He has since had therapy and treatment, to which he is in a safe place in order to complete this progressive block of training. Rio has had some previous training experience of around 1 year. Before the block of training, some strength testing procedures took place in order for myself to see where his current strength levels were. To do this, we used 1RM testing procedure. This is known as the most maximal amount of weight which can be lifted once with correct lifting technique, which is seen as the gold standard way of testing maximal muscle strength. His 1RM bench press was measured at 82.5 kilos and his 1RM deadlift was measured at 120 kilos. His 1RM bent over row was further measured at 65 kilograms. The method of periodisation that I used for the programme was linear periodisation. Linear periodisation was created to attempt to maximise strength development. The model of this training is characterised by training that starts at high volumes and low intensity exercises, with volume reduced as intensity increases as the athlete works towards his or her peak, which typically is done over a 10 to 12 week cycle. For the case of my progressive block, this will only be carried out for 5-week cycle. Now, why linear periodisation? The reason why I have chosen this method over other methods such as non-linear or daily undulating periodisation is mainly down to the programme's simplicity, as it is simply a reduction in training volume and an increase in load or intensity. This is done gradually rather than having to vary both volume and intensity daily, like with daily undulating periodisation. It has also been seen to be more or just as effective as other methods of periodisation and exercise programming. Linear periodisation also elicits a good level of strength increases, especially for untrained or novice individuals. Exercise selection. The exercises selected for this program is as follows: a conventional deadlift, the barbell flat bench press, a unilateral dumbbell forward lunge, and a bent over barbell row. Now, the reasoning. I chose the conventional deadlift as it is known to work all of the prime movers and most of the muscles in the abdomen and lower body, with emphasis on the erector spina, lower back and upper back, along with muscles of the quadriceps, hamstrings and gluteus maximus. Therefore, would be a good exercise when developing full body strength. The exercise has also been seen to be very effective at increasing knee and hip explosiveness for vertical jumps, which in terms of sports performance and specificity, vertical jump height and hip and knee explosiveness is crucial for high impact sports such as football, where there are bouts of explosiveness, especially for his position. The barbell bench press was selected as the main upper body horizontal pushing movement. The barbell bench press was chosen over other methods such as the Smith machine or seated chest press machine, due to free weights having a higher EMG activity in the stabilising muscles in the upper body, therefore suggesting upper body stability around the shoulder would be greater. It has also been shown that an increase in total upper body strength may increase throwing velocity. Again, this could have some importance or carryover into his sporting performance. As for the unilateral forward lunge, the reason for this exercise selection is due to it being more specific for his sport, as it is more common for a football player to be in a position in which one foot is in front of the other, also known as a split position, rather than a squat position where both feet are next to each other parallel. The lunge may also have some positive implications for muscle imbalance of the quadriceps, which if performed correctly should challenge the knee extensors or the quadriceps, therefore suggesting that the muscle imbalances could be restored, as well as strengthening all the other muscles surrounding the hip, which it has been seen to do. The barbell row was chosen as it is seen to activate musculature symmetrically across both the upper and lower back. It has also been seen to create the most spinal stiffness, which is important for trunk stability. This exercise may also be a good selection for Rio's injury of the hip, as it is stated that hip micro-instability injuries should focus on strengthening of the lower back, abdominal core strength, and the strengthening of the iliopsoas, which this movement has been seen to do through trunk stimulation. Throughout this progressive blocker training, loads had to be monitored just to make sure there was no risk to the athlete's health and wellness. Both internal and external loads were measured as a combination, as it's often recommended for optimising your training. As for the internal load, I used RPE, or rate of perceived exertion. This is done via asking the athlete how difficult a certain exercise or movement is on a scale of 1 to 10. This method of internal load monitoring was used due to it being inexpensive and it requires no equipment. As for monitoring the external load, a 1RM percentage-based training load scheme was used, meaning that the percentage of his 1 rep max were calculated, and then that would help determine the weight on the bar. The loads would range from 65 to 85%, making this program more of a submaximal approach to strength training due to the majority of the loads being in the 60 to 75% range. There has been seen to be no significant difference in the heavier loads and lighter loads for strength increases. Only lighter loads will be safer. However, in the later stages of the program, some heavier loads of 80 to 95% of the 1RM were used, with the suggested rep schemes of 1 to 4 to optimise strength adaptations. The reason for why I didn't exceed any percentages above really 90%, especially in the case of the deadlift, was due to there being a high correlation from form breakdown and percentages higher than 90%. This principle was further just added to all the exercises just for a safety consideration. For my warm-up, I followed what is known as a RAMP protocol, which stands for Raise, Activate, Mobilise and Potentiate. This protocol has been very well described by Ian Jeffries. The way I used the protocol was an integration of the stages. For example, I used a dynamic walking lunge to raise the heart rate, activate the lower body musculature, and to mobilise the hip, knee and ankle joints. You may even argue that this was also used as a method of potentiation, as a forward lunge would be performed later in the program. This exercise was followed by a bodyweight squat, more specific to activating all the tissues in the lower body. The next two exercises are also related to activation, but primarily for the trunk and spine. These exercises are 2 out of 3 of Stuart McGill's Big 3, described in his book, The Back Mechanic. These are used to promote spinal stiffness by activating all the muscles in the trunk. These exercises were the bird dog and the side plank. After this, some upper body activation and mobilisation was performed. This was done through a simple push-up. Finally, for deadlift specific potentiation, as this would be the first exercise performed, a kettlebell swing was used to reinforce the movement of the hip extension and hip pinching, which has been suggested to have great carryover effects on the deadlift. The reasoning behind sets, reps and rest times. Due to me following a linear periodisation model approach, we know that at the start of a progressive block, we need to start with a higher training volume and a lower intensity for this to actually follow the linear progressive model. The first week has Rio start off at 5 sets of 5 reps, which is within that 3 to 6 set range, which has been seen to be optimal for strength increases. The rep scheme is between the 1 to 6 rep range also, which has also been seen to be optimal for strength. As for rest times, I've chosen periods of 3 minutes between sets to give the nervous system and tissues adequate time to recover. 3 minutes has been seen to be the optimal inter-set recovery time to allow more repetitions and sets to be completed. Reasoning for exercise order. I chose to do the heavier compound movements such as the deadlift and bench press first, mainly down to the fact that these exercises involve multiple muscles and are what are deemed as a multi-joint exercise due to more than one or two joints functioning to perform the movement. It's shown that by doing these heavier compound movements first, you're able to maximise the amount of force produced and the load lifted before you move on to the lighter, isolation or less focused exercises. The deadlift was chosen first due to it clearly being the more multi-joint dominant exercise. Secondly, I chose the bench press, as this was the most dominant upper body exercise and I wanted to variate from lower body to upper body exercises to give each muscle group some short recovery times between sets. In terms of cues or coaching points given to Rio, the main things I said were about his deadlift, focusing more about pulling the slack out of the bar. As for the lunge, his lunge width was a moderate step, not long or short, but somewhere in the middle, just to reduce any unwanted forces on the cruciate ligaments in the knee. Week 2. As for the sets and reps, we are keeping the rep scheme the same, but are decreasing the amount of sets by 1, just to slowly decrease the total training volume. However, intensity was increased ever so slightly to recreate the linear progressive model. Intensity was only increased by 2.5% on all of the lifts. This was done to apply the principle of progressive overload, which is needed to progressively increase the stress on muscles so that they become capable of producing greater forces and power. The cues for week 2. Again, we worked on pulling the slack out of the bar to try and stop his hips from shooting up so fast. This cue is important for him to be able to build tension throughout his body and activate his muscles correctly by getting in a good position. The cool down. A 5 to 10 minute foam rolling session would take place after the session, having roughly around 45 to 1 minute per muscle group, as this has been seen to significantly reduce muscle DOMs and even improve athletic performance. Some basic static stretches were performed across all major muscles used for the suggested time of around 30 seconds for 4 sets per muscle group. This has been suggested to help with muscle soreness after exercise. Week 3. The sets and reps for this week, we again increase the intensity by another 2.5% to elicit the progressive overload, and the total sets decreased by 1 set, making it 3 sets of 5 reps. Again decreasing the total training volume, still within the lines of the linear periodisation model. After the first 3 weeks, the last 2 training sessions, the last 2 weeks were unable to go ahead just due to the global COVID-19 pandemic. However, these sessions were planned out. They would have followed the exact same principle as the previous 3 weeks, so a reduction in volume and a further increase in intensity. However, there was a little slight difference where this time round, for the 4th week, we would increase the intensity by 5% rather than 2.5%, and the training volume, so the sets, would be 5 sets. So it would actually match the previous week's training volume, only the intensity would have increased furthermore. For the 5th week, we would further decrease the volume again down to 3 sets, and again another increase of 5% in intensity, keeping with the 3 rep scheme, but just reducing that sets, or the sets of the exercise, down to 3 sets rather than 5, which is trying to match that linear periodisation approach, trying to reduce the volume and increase the intensity. That final training intensity would have been around 85%, so as I stated, this seems to be in that optimal zone for strength adaptations. These weeks would have been followed up with a retest in 1RM to see if the cycle was effective. After that 5th week, you would then use the new 1RM scores to calculate percentages for the next block of training, and you could repeat that whole progressive block of training. So how effective was the actual block of training? So obviously we couldn't actually retest his 1RM, so there's no actual way of knowing if he did get stronger, but just by looking through the weekly training sessions, I have to say he must have got stronger, and that's purely down to him being able to increase the intensity week to week and not actually failing any of the sets or reps. So just from that alone we could infer that his strength must have increased. So if I was to actually do this progressive blocker training again under the same global circumstances, that being the COVID-19 pandemic, what would I do differently? So if I was a little more prepared for maybe what was going to happen, we could have easily followed that up with a progressive body weight 2-week protocol, so to finish off that program. That could have been done the same way as the actual resistance training program, that being that reduction in volume and that increased intensity, and he could have done that in his own home. If total training volume decreased, intensity increased, that would still come under that linear periodisation, like I said, and actually due to the lighter loads of bodyweight training, an even higher volume accumulation could have been used, as it's shown to actually be most effective for muscle hypertrophy. Now, although he didn't actually say muscle hypertrophy was his main goal, there has been seen to be a lot of research that suggests that muscles may need to go through a phase of hypertrophy to elicit the best results for an increase in muscular strength and power. So as for the actual resistance training block, things that I may have changed are the weekly sets on the exercises. As this 5-week block, we were only training once per week, so probably would have been more effective if we were to train 2 or 3 days per week, just because we're able to get that weekly training volume a little bit higher. And if we were to try and get it to the suggested 8 sets per muscle group weekly, which would seem to be optimal for maximising strength, there's a chance his results may have been a little bit better. So that was the progressive 5-week block that I designed and planned with the periodisation method of linear periodisation. Thanks for watching. I hope you've learned something, and maybe you can apply it into your own training or somebody else's.